today I'm gonna perform your cranial nerve exam. Yeah. Before we start, I need to fill in some data of yours, and from our previous visit we already have some, but I need to clarify. Okay, could you please tell me your address again? Oh, okay. Perfect. Great. So, tell me please, how do you usually feel after waking up? Do you ever have any dizziness, any like flashes or flickers in your eyes? Alright, good. I see. Perfect. And then, what about any kind of like shortness of breath? Good. And then, what about any kind of like noise in your ears? Perfect. And what about your chest? Do you ever feel any pain or discomfort in your chest area? See, that's marvelous. Great. Alright, now I'm gonna put on my gloves and give me a second. After that, we'll finally start the exam. Yeah. So, since it's not your first cranial nerve exam, I believe there's nothing to be scared of, so you can relax. Okay, good. Let me touch your face for a second. Okay. Yeah, alright. Okay, so do you feel me touching both sides of your face? Okay, great. Alright. Now, could you please clench your teeth tightly together for me? Okay, great. And now, could you please relax your mouth open, like, your lower jaw? Okay, and there for a second. Now, could you please stick out your tongue? Yeah, and I'm gonna press on it with a spatula really gently. So again, there is nothing to be afraid of. Yeah, last time we didn't do that. Okay, so yeah, okay, yeah, open your mouth and say like that. Yeah, okay. Okay, perfect. Great. You're doing great. Okay, just a second. I will note down. Awesome. Okay, and now your eyes. Could you please follow the light for me? Yep. Okay, good. Yeah, up and down. Good. Okay, doing great. Follow the light, keep on following, you're doing great. Okay, good. You're doing perfect. Alright. Okay, good. Awesome. Thank you so much. And now very similar task. So you need to follow this stone on the pencil. Yeah, can so please follow it. Follow it. Good. You're doing great. Yeah. We will actually have a more detailed eye exam later. Keep on following, yeah. And for today, I believe that would be it. Yeah, I mean regarding your eyes. Okay. Good. Good. Keep on following. Keep on following the stone. Okay. Perfect. You're doing simply perfect. Okay. Let me note that down. Good. Awesome. And now, could you please straighten your arm? Let's start with the left one. Yeah, just straighten it before you, and I need you to reach the tip of your nose with your index finger. Yeah, so like very typical procedure. Just relax, and let's do it. So yeah, okay, perfect, good. And now exactly the same with your right hand. Yeah, with your right hand, index finger. Yep, you need to straighten your arm. Yeah, like you did before. Good. And now could you please reach the tip of your nose? Oh, okay, perfect. Good. Thank you. Alright, and now let's test your hearing a little bit. Have you had any changes in your hearing lately? Maybe some troubles that I faced or some weird symptoms? Okay, good. So, now you're gonna close your eyes and you will let me know when you hear me snapping like that. Good. So close your eyes, relax, and let me know. So let's start. Good. Okay. Alright, good. Good job. Yep. Good, right here. Alright, good. Once again. Good. Now, I need you to count how many times I snapped. And again, you will tell me how many times you heard me snapping. So again, close your eyes. Relax. It's not really that challenging, just pay attention. Focus. Please don't get distracted by anything else. Good. So, let's go. Four times. Good job. Now once again. 2. Right here. 3. Good job. Okay. 5 times. Good. 3 times again. Okay, what about now? 2 times. What about now? 4 times. Good. 3 times again. I did it once. Good job. Okay, 1 time again. 2 times. 3 times. You're actually doing great. Now, one more small test. You will let me know which side you hear the sound on. So again, you need to close your eyes and simply let me know if it's like on the left or on the right. Let's go. Which ear was that? Good job, right here. Yeah. Good, perfect. Okay, what about now? The same side. Good job. Got it. Yes, right here. Good job. What about now? Yes, right here. Good. Both sides. Right here, the last one was on both sides actually. Good job. Okay, and now one more small test. You will let me know if the sound was actually close to you, to your ears, or if it was like far away. It is actually pretty simple too. So again, close your eyes and just relax. Let's start. Yeah, that was pretty close, right? Yeah. What about now? Close as well. Okay, good. Yeah, that was pretty far. But now, close again. What about now? Far away. Close again. Good job. Okay, yeah, that was pretty far. What about now? The same. Good. Close. Good. Good job. What about now? Close. That was far away. Close again. Close again. Close again. Far away. Far. Far. Right here. Close. Close. Close again. Good job. You're doing amazing. Seriously, yeah, that's wonderful. So you can open your eyes. Good. Okay, you're doing great so far. Thank you so much. Just a second. Let me note it down. Yep. So check for this and check for that. Okay, marvelous. And now the next part. What I need to check is your nose. So I have a tiny piece of cotton, and what we are gonna do is that you need to close one of your nostrils. Let it be left for now, and I will just put it close to your nose so that I can see if your right one works well. Yeah, so if you can breathe through the right one. So close your left nostril and try to breathe in and out, in and out. Good. Okay, now the same with the right one. Okay. Again, try to breathe in and out, in and out. Okay, awesome, great. So yeah, it's fine for both. So great. Okay, now let me check your blood pressure and pulse. I have blood pressure monitor, and I need to put the cuff on your upper arm. So that would be wonderful if you took off your sweatshirt, or at least you can pull up your sleeve up. And yeah, I will put the cuff on your upper arm, and then I will have to tighten it, so it can be a little bit uncomfortable, but it shouldn't be really that painful. So just in case, if you feel the pain you cannot take, let me know and I will stop immediately. Yeah, so give me your arm, please. Put it on your upper arm. Yep, right there. Good. Awesome. Yeah. How does it feel for now? Okay, good. So now, as I said, I'm gonna tighten it up. Please relax. Relax and please be silent for a moment. Yeah, I need you to be quiet. Okay. Ready? Let's go. Okay, good. Your blood pressure is totally perfect. It's 120/80. It's like absolutely perfect. And your pulse is still right as well. It's like 78. Yeah, like 78 heartbeats per minute. So it's totally fine. Yeah, absolutely. So tell me please a little bit more about your physical activity. Are you an active person? Do you work out? Do you do sports? Yeah. Okay. Great. Well, that's actually wonderful. Yeah. Okay. I see that. Wow. Awesome. Well, yeah, I can see that you're pretty active and that you don't have like a totally sedentary lifestyle. It's really, really important. Yeah. You should work out, but like you don't have any problem with that since you already do, and I think that should be more than enough for you. And yeah, like swimming is also really, really good, really beneficial to your health, and like muscles, your lungs, like breathing. It's perfect training for like all body. Yeah, if you don't like weightlifting or like other kinds of workouts, swimming is like a perfect alternative, and it's really, really good for your spine as well. Like it helps your back like relax and so on. So it's really perfect, and if you enjoy that, then go for it. The next thing I'm gonna do is to listen to your lungs, and you will breathe in and breathe out, and you will hold your breath for a little bit when I tell you to. Yeah, so for now you can just stand, yeah, like that. I will let you know when you need to turn your back. Okay. Okay, so breathe in. Okay, good. Now breathe in again and slowly breathe out. Good. Okay, thank you. Now please turn your back to me? And we'll do the same. You will raise your arms and I will listen everything. Okay. Good. So, could you please breathe in? Hold your breath for a second and breathe out. Good. Now once again the same thing. And once again. In. Hold there for a second. Breathe out. Okay. Yeah. Good. That's actually wonderful. Yeah. Well, I didn't hear any noise in your lungs, and your heartbeat is totally fine as well. So yeah, that's really perfect. Alright, so I'm really happy with your results. Thank you for today's appointment. It was a pleasure to see you again. And I'll be waiting for our next meeting. Yeah, for your detailed eye exam, for your detailed ear exam. Yeah, don't skip it. It's quite important as well. So, you did wonderful. And have a nice day. Bye. Oh, hello. I see you never skip your cranial nerve exam. Wonderful. I'm so happy to see you again. Okay, let me put on my gloves. I'm done. What about you? Are you ready? Okay, amazing. So please look at my nose and tell me when you see my fingers wiggle. Let's start. Okay, good, amazing. What about now? Keep on looking at my nose. Good. Keep on concentrating on my nose. Amazing. Good. Okay, good job. Now, could you please tell me which of my fingers is wiggling, right or left? But please keep on concentrating on my nose. Okay, wonderful. Good job. Okay, great. Wonderful. Amazing. Good. Okay. Good. Wonderful. So now could you please follow the light for me? Concentrate on the light and keep on following it. Keep on following. Keep on following the light. Keep on following the light. Keep on following the light, please. Keep on following the light. Keep on following the light. Okay, amazing. Amazing, you're doing great. Doing great. Wonderful. Good. Now, let's check your olfactory nerve. I have a few fragrances for you. Let's test if you can recognize the smell. So, I have some nice paper and I'm gonna spray the fragrance on the paper and let's see if you are able to recognize it and identify it. Okay. What does it look like? I mean, what does it smell like? Sorry. Yeah. Okay. Wonderful. Vanilla, right? Yeah. Good job. Okay, the second one. Okay, what about this one? Okay. Yeah, you're close. Almost. Yeah, right, yeah, peppermint. It's hard to confuse it with something else, right? Okay, amazing. And finally, the last one for today. What about this one? What does it smell like to you? Yes, right, yeah. It's some kind of a berry, but which one? Yes, right, yeah, strawberry. Okay, good job. Now the last test for today. Could you please straighten your arm, and with your index finger you need to touch your nose. Yeah, but you have to close your eyes. Okay, so concentrate, close your eyes and touch your nose with your index finger. Let's start with your right arm first. Good job, that's marvelous. What about your left arm? Good. Amazing, you're doing great. All your nerves work really, really well. Yeah, perfectly well. So, see you next cranial nerve exam. See ya. Bye. Oh, hello, how are you doing? That's actually wonderful. Welcome to your ear exam. Today we're gonna have a really short hearing test, and for that I'm gonna use this beautiful tuning fork. Are you ready to start? Okay, awesome. I will place it behind your ears. Yeah. So don't be afraid. It's not gonna hurt at all. Let's start. Could you please tell me when the sound is not heard anymore? Okay, wonderful, that's amazing. Okay, let's test the other ear. Again, you have to let me know when the sound is not audible anymore, when you cannot hear it any longer. Okay, amazing. Okay, I see that. Let's try one more time. Okay, wonderful. And one more time. Okay, that's amazing. Great. Okay, now let's test your speech reception threshold. But in order to do that properly, we need to create a little bit noisy environment. Because actually, if we want to measure your ability to separate speech from the background noise, we actually need to have this noise. Am I right? It's pretty logical. Okay, wonderful. So I'm gonna make some background noise using my gloves, and I'm gonna tell you some short sentences. Yeah, from ear to ear. I'm gonna whisper them so that we can really see if you hear them or not. Okay, wonderful, amazing. So let's start. Okay, good. My favorite dessert is butterscotch. Okay, so what did you hear? Oh, that's great. Good job. What about now? I have a peanut toast for breakfast. Okay, how was that? Did you manage to hear what I said? Good. Amazing. What about now? She is wearing striped pajamas. So what have I said? Okay, wonderful. That's great. You're doing good. I have no doubts that your hearing is perfectly well. Yeah. Okay. See you next to your exam. Good night. Bye. Hey there. How are you doing? Welcome to your eye exam. I have a few questions for you, if you don't mind, of course. Do you wear glasses or contact lenses? Have you had any complaints about your sight recently? Okay, wonderful. What about any family history of eye disease? Okay, great, that sounds good. Now, if you're ready, we could start the test. Sure, let's do it. Please look at my nose and tell me how many fingers I'm holding up. Yeah, we're gonna test your sight vision, so I really need you to concentrate on my nose only. Don't look at the side. Wonderful. So, how many fingers am I showing? Amazing. What about now? Wonderful. What about now? Good job. What about now? Wonderful. What about now? Good. What about now? Now. What about now? Okay, you are doing great so far. I have very interesting glasses for you. with the help of these glasses, we're gonna test your eye muscles. So I'm gonna tell you the number and you will simply follow it with your eyes. Okay, good. So could you please look at number 5? Amazing. What about number 8? Good job. Number 4, number 7, number 3, number 8, number 6, number 2, number 1, number 2, number 3. Good job. Number 4, number 8, number 3, number 7. 4 again, 7. Okay, good. 4, 7 again, 8, 3, 5, 6, 2, 3, 4, 1. Amazing. Please tell me if you can see any numbers there. Yeah, let's have a look at them. Okay, so what about this circle? Can you see any number? Okay, good job. About this one? Okay, amazing. This? Yes, right, sure. Okay, what about this one on top? Okay, doing good. This? And here, do you see any number there? Maybe something else, maybe it's not the number. Okay, that's amazing. I have really good news for you. You're not colorblind. That's actually great. Have a nice day. Yeah, see you next time. Bye bye. Hello, sweetie. How are you doing? I see today you came to check your teeth, and I do appreciate it, because checking your teeth regularly can save you lots of time in the future and lots of trouble, by the way. Good. So let's start. Could you please open your mouth widely, like exactly this way? No need to say actually, but yeah, just open your mouth widely. I have a special dental mirror using which I'm gonna inspect your teeth and your gum and it's like your mouth cavity in general. Let's start. Okay, good. Okay, this side seems to be alright. What about this one? Good. Okay, what about this one? Okay, good. There. Okay, amazing. For now, I don't see any trouble. Let's use a floss. Do you floss your teeth regularly? Oh, you should. Let's do it. Okay, come closer to me. Okay, wonderful. Good. Okay, a little bit here, a little bit. Okay, now they look perfect, almost. Okay, the next thing I have for you is a special rinse liquid. Oh my god, it matches the background. Isn't it amazing? And it also creates wonderful sound, but it's not why we are here today. So I'm gonna pour it in this plastic glass. Yes, sweetie, I know plastic is very, very bad for our environment, but since our clinic has lots of them, we just simply need to use them. Sorry about that. Okay, take it. The next thing I'm gonna do is to put fluoride on your teeth. So could you please smile widely for me? As wide as you can. Okay, I love your smile actually. Yeah. So, yeah, please keep your mouth open. Fluoride is gonna help you get rid of this extra sensitivity. Yeah, keep on smiling. Okay, good, wonderful. And finally, I have another recommendation for you. It would be a special mousse for your teeth and for your gum as well. Put some on this disposable toothbrush, and we're gonna put it on your teeth and on your gum as well. Don't be scared, it's totally fine. It's actually pretty tasty. It has this like kind of fruit mix flavor. Okay, yeah, keep your mouth open because this thing actually needs to dry. Yeah, to dry up. And you're loaded. Oh, you look amazing. I love your teeth and I love your smile. You should actually smile more often. I'm telling you. You can trust me. You can trust me. Yeah. But don't forget to come to me next time. Yeah. You have to visit your dentist regularly if you want to have really nice teeth. Sure. See ya. Bye. Hello. Welcome to our clinic. Is it your first cranial nerve exam? Oh, okay. So you're an experienced patient. Wonderful. I'm happy to hear that. How are you feeling today? Okay, that's actually great. Before we start the actual cranial nerve exam, let me listen to your heart and your lungs first, okay? Okay, good. Wonderful. So, could you please pull up your sweatshirt for me? Okay, great. And now let's start with your heart. Relax, just relax. Okay. Okay, good. Good. Your heartbeat is just fine. Now your lungs. I want you to breathe for me. Yes, so now inhale deeply and exhale. Okay, let's start with this side. Exhale. Okay, wonderful. Now this side. Exhale. Yeah, okay, okay, great. Good. And now this side again. Exhale. Now I want you to breathe in and hold your breath for a second and then breathe out. Breathe in, please. Hold there. Hold your breath. Okay. Breathe out. Okay, amazing. Now turn your back, please. Good. And the same thing. Inhale. Exhale. Good. Exhale. Okay, amazing. And now this side again. Exhale. Okay. Okay, good. So your heart and your lungs are working just fine. Good news. So now let's start the actual cranial nerve exam. Yep, shall we? Okay, good. So first the light. Please follow the light for me. Okay, good. Good. Yeah, we're testing your orbital nerve. Wonderful. Yeah, keep on following the light. Don't get distracted, please. Okay, good, good, good. Okay, wonderful. Good. Good job. Okay, amazing. So now let's test your side vision, your peripheral vision, and I would ask you to look at my nose, straight at my nose, and not get distracted by anything else. But at the same time, tell me when you see my fingers wiggle. Okay, good. Let's start. Good. Wonderful. Okay, now tell me which side it is. If it's your right side, left side, or actually both sides again. Good. Good. Wonderful. Okay, great. Good. Both sides. Okay, amazing. Good. What about now? Good. Both sides again. Okay, wonderful. Keep on looking at my nose and tell me how many fingers I'm holding up. Okay. Good. Amazing. Wonderful. Great. Good. Okay, wonderful. You're actually doing great. Good. So now let's test your vision. But now I'm not interested in your side vision anymore because it's wonderful. I see no trouble with that. But with your actual vision, how good your side is. Sorry for this background noise. I have too many tools in there. Okay, good. So look at the eye chart. chart, please? I know that we have another one on the wall, but it's like too far, and I don't want you to be tense. I want you to stay relaxed. Yes. So, please read this line for me. Yeah, the whole line. Okay. Okay. Good. Good. Right, yeah. Okay, wonderful. Now, what letter is it? Yeah, that was relatively easy since the letters are larger in this line. Okay, and now let's make it a little bit more challenging for you. What about this letter? Good. What about this letter? Amazing. What about this sign? What is it? Okay, wonderful. This. Now this. Okay, now this one. Great. This one. Okay, this one again. Now this one. What is it? Okay, amazing. And now please read the very, very bottom line for me. Okay. Okay. Good. You're almost right. Could you be more specific? Yes. Yes, right. You are. Good. Yeah, alright. And finally, the last symbol. Okay, good. You are actually doing great. Now, let's test if you can differentiate between colors. I mean, it's relatively easy. Oh, my goodness. Sorry. So, about this one. Can you see any figures? Anything there? Any numbers? Oh, okay, good, really. What about this circle? Right. This one. Oh, amazing. This. Now this one. Okay, good. This. And this again. Actually doing great. Now let's take a very similar chart, but the colors are a little bit more like pale here, not so bright. Can you see anything here? Okay, what about this circle? This one? Yeah, that was relatively easier. And this, and this, and this one. Okay, well, still, you're doing great. You're not colorblind. I have really good news for you. Amazing, good, doing great. Now, your hearing. For that, I'm gonna use a pretty simple test with a tuning fork. I know that everybody likes it, right? For some reason. Okay, just a second. Give me a tiny moment. I know that it's been a little bit messy today because I have so many things in there, but anyway, you know what to do with it, right? I'm gonna produce a sound using this tuning fork, and I will put it behind your ears, and you will let me know when you cannot hear the sound anymore. Okay, good. So you can close your eyes, relax here. You don't need to look at anything. Simply relax and let me know when the sound cannot be heard anymore. It's simple. Okay, good. Can you hear it? Okay, what about now? Okay, good, right, sure. Cannot be heard anymore. Okay, let's try again. The other ear. Can you hear anything? Yeah, me neither. Okay, let's try again. Now, yeah. Okay. Okay, good. Good. Okay, now you cannot hear it anymore. Good. Right, sure. Okay, wonderful. So, it seems to be alright. I actually have an otoscope, and I know that it's not like a complete, completely ear exam hearing test, but let's have a little look in your ears since you are here. Yeah, I guess we'll do a complete normal hearing test, like ear exam, maybe some ear cleaning next time. But since you're here, yeah, this one is totally clean. It's fine. I do not see any earwax buildups or some stuff like that. And this ear, okay, it seems to be just fine as well. Okay, wonderful. So actually happy that you're hearing and your ears are in really good shape. Okay, now let's test your actual nerves and reflexes. I have some stuff for you. So the first thing would be this nice silver shiny hammer. Don't be afraid, it's not gonna hurt. What I need you to do is to relax and simply straighten your arms a little bit. We'll start up with your wrists actually. I'll touch your wrists with this hammer. Yeah, and I will just see if your reflexes work well. Good, but all you need is just to relax. Okay, relax. Let's do it. Okay. Good. Okay, wonderful. Okay, this side is fine now. The other wrist. Good, amazing. Your elbows, please. Good, it's working just fine. I don't see any deviations. Okay, wonderful. So now we're gonna test on the nerves in your knees. Yeah, it's like a knee-jerk reflex test. Yeah, what I need you to do is to bend your legs, your knees, and like cross them. So put one leg over the other one, and yeah, exactly like that. Good. So good. Yeah, it works just fine. Now switch your legs for me, please. Okay, good. Everything is working really well, so that's actually wonderful. Now I have another hammer. It looks less scary than the previous one, I suppose. Okay, I'm actually interested in your feet now. Yeah, you will have to take off your socks, and I'm gonna check your feet with this one, this beautiful hammer. Okay, just relax, it's not gonna hurt. You can trust me. Okay, good. Okay, wonderful. Oh, you heal. Oh, good. Good, amazing. Now the other one. Okay, good. Good. Okay, amazing. So, and now please close your eyes and tell me when you actually feel this hammer touching you, and if you can feel anything, tell me where exactly I'm touching you with this hammer. So yeah, let's start with your upper body. Good. So, okay, your forearm, your left forearm. Okay, good. And your elbow. Good job, amazing. Keep your eyes closed, don't cheat. Okay, wonderful. Then your right wrist, right? Okay. Okay, right shot closer to your shoulder. Good. Amazing. Yes, wonderful. Now please let me know if you feel it warm or cold. Yeah, if I touch you with a relatively warm or cold metallic part of the hammer. Yes, it's warm. Good. And where am I now? Okay, your middle finger. Okay, wonderful. Is it closer to your nail or to your wrist? Right, where am I now? Okay, your palm. other item. As you can see, this one is relatively sharper than this hammer, right? So let's say that this one is dull and this one is sharp. And again, guess what? You're gonna keep your eyes closed and you will let me know if you can feel it sharp or dull. It's really hard to confuse them, but I'll try to trick you maybe. Okay, let's make it a little bit challenging for you, right? Shall we? Good, so let's start. Okay, that is sharp. Good job. Okay, good. What about now? Yeah, that is quite dull. Okay, good. What about now? Is it sharp or dull? Yeah, that was sharp, right? Yeah. What about now? Is it still sharp or dull? Yeah, that is definitely dull. Okay, good job, wonderful. Good, and now again, is it sharp or dull? Yeah, that's definitely dull. Okay, good. And what about now? Is it still dull? Is it sharp? How do you feel it? Okay, this is sharp. Okay, wonderful. Good job. You're actually doing great. I don't know if it's your intuition or your eye sensitivity, but so far you haven't made a single mistake. It's amazing. It's an amazing result, believe me. Okay, I'm an experienced doctor. I know what I'm saying. Okay, good. Now we will do a pretty similar test, but this beautiful brush. Yeah, I know it looks like some kind of a fairy with this nice unicorn brush, but yeah, I'm just a simple doctor. I like pretty lovely things and it matches the background, right? Anyway, again, first close your eyes and tell me if you feel me touching your face with the brush, okay? Let's start with that. Simply yes or no, okay? Good, let's do it. So okay, good. Yeah, I was really touching your face. Wonderful. Keep your eyes closed. Okay, good. And what about now? Can you feel anything? Can you feel anything? Can you feel anything? No, you can't. Okay, you're right. I wasn't really touching your face. Okay, what about now? feel if they are gonna be nice and pleasant for you or not that much. But let's try. Well, anyway, we simply need to test your cranial nerve, your olfactory nerve more specifically. So doesn't matter what kind of smell it is, isn't it? Okay, good. So what does it smell like? Well, it is definitely some kind of berry. Could you be more specific? What does it remind you of most of all? Because yeah, this one is a little bit tricky. Raspberry. Yeah, you're actually right. It's kind of like a raspberry pie, because it also has some slight vanilla notes in it. But yeah, raspberry is definitely the dominating smell. Okay, good, great. Now, what about what did it smell like? Oh my god, I actually sprayed so much fragrance on it that I don't even need to put it very close to your nose. You can feel it right away, don't you? So what does it smell like? Yes. Okay. Coffee. It's actually hard to confuse it with anything else, but you know, like still there were some patients who failed to guess in this one. I mean, they would name anything but coffee. But I guess it can be truly confusing sometimes, because we have so many associations with coffee, like some desserts and some like pastry stuff and so on. Like, do you actually drink coffee a lot? Yeah, you know, like you should drink it like some like moderate amounts, because when it's too much, it's not really good for your heart. But since your heartbeat was totally fine, then I don't need to worry about it. Okay, the last smell for today. What does it smell like to you? Does it smell like to you? Some fruity, nice smell, maybe citrus. Citrus, right? Yeah. What kind of citrus is it? Yeah, it's not orange. You're right. It's not orange. Orange is like somewhat sweeter, I would say. So what is it? Grapefruit, right? Yeah, I love grapefruits. Grapefruit juice and like gel with grapefruit tastes like, anyway, whatever. So for now, I don't see any trouble with any kind of like nerves and stuff. I know that it wasn't like the fullest, the most detailed cranial nerve exam, but I guess for today we are done. That will do for now. Yes, and next time when you come for a really detailed cranial nerve exam, we'll actually take some more tests. Yes, we'll do some other stuff. Okay, the last thing, could you raise your eyebrows for me? Okay, amazing. Could you puff your cheeks for me? Okay, you're doing great with it. Now puff your cheeks, don't let me close them. Okay, good. Shrug your shoulders for me, please. Okay, good. From me. Now could you give me the widest smile possible? Amazing. Now relax, and I want you to relax all your body, all your muscles, except for your heart, and simply enjoy this evening or day or whatever time it is for you, and good night. I'll see you next time. Yes. Bye bye.